Hi, Mr. Chappell. How are you doing today?
Great.
Excellent. I'm Elizabeth. I'll be your speech-language pathologist, and I'm here to work on your clinical bedside evaluation.
Okay.
So to this evaluation, there are two parts. In the first part, I'll be looking at the structures and the functions of your oral mechanism, so in your mouth. And for the second part, I'll be doing food and liquid trials. So I'll give you different foods and a liquid of different consistencies to assess your swallowing abilities. It should take about 20 minutes for the full battery assessment. And do you have any questions for me?
No, ma'am.
Great. Let's begin. Are you ready?
Yes.
Okay, first I want to be sure that you're sitting up straight in a 90-degree angle, that you're comfortable.
Yes.
Great. So the first task I need for you to do is to hold your breath for about 6 seconds. So if you can take a deep breath in and hold, I will let you know when you can release. Great. That was excellent. Okay, for this next part, I'm going to take a look in your oral cavity, so in your mouth, and I'm going to put these gloves on to protect us both. I'm also going to have this tongue depressor, strawberry flavored. I hope that's okay with you.
Yes.
And I have a pen light as well to look inside your mouth and check out these oral structures. So let's get started. Thank you. Great. You can see your tongue, your uvula, your fascial pillars, lateral sulci, your dentition. Excellent. That all looks great. Very healthy. Okay. So now I want to take a look at your jaw. Can you open and close your jaw like this for me? Excellent. Now I'm going to do it with a little bit of resistance. So I'll push here and I want you to open your jaw. Great. Now leave it open just a little. Great. And I'll hold and I want you to close. Excellent. Very healthy jaw. Now I want you to try and jut it out to the front just like this, like an underbite. Perfect. And lateralize. So move it side to side like this. Great. Okay. Now let's look at your lips. I want you to protrude your lips, kind of purse them like you're giving a kiss. Great. And draw them back into a smile. Awesome. Now I want you to fill your cheeks with air and keep that air in your oral cavity by sealing those lips, just like this. Great. Now I'm going to, you can release that air. Now I'm going to put the tongue depressor back in your lips. Don't hold it with your teeth, only your lips. And I'm going to try and tug it out. And I want you to grip onto it with your lips, okay?
Okay.
Great. Excellent. That was perfect. Now we're going to take a look at your tongue. And I want you to go ahead and stick that tongue out for me. Great. And pull it back in as far as you can. Wonderful. Also, can you lateralize that tongue? Move it side to side like this. And lick your lips all the way around. Excellent. That was great. Now I want you to try and clear your palate from the front to the back, like you're licking peanut butter off of the roof of your mouth. Great. Can you elevate that tongue to touch the tip of your roof of your mouth like this? And now outside of your mouth like this. Excellent. For the last thing, can you make your tongue look like you're doing the G sound? You don't have to make the G sound. Just put your tongue in that place. Great. That was perfect. Can I take a look at that with the pen light? Excellent. Okay. And now I want to put my fingers on your cheeks and have you push against my finger with your tongue. Excellent. That was great. Okay, now for this next part, I'm going to have you do some different sounds for me. So I want you to sustain the sound for about 10 seconds. So I'll let you know when that time's up. The first sound is the P sound. So it'll sound a little like this. P, 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 P. Your turn. Great. Now I want you to do the same thing, but this time I want you to do the t sound. So t t t t t t t. Great. And now I want you to do that again with the k sound. So k k k k k k k. Great. And for the last sound, I want you to put all of those together to make the puttica, 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 puttica. Puttica, 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 puttica. Great. When you were doing those, I was trying to assess your rate and rhythm of your speech. You did an excellent job. So for this next part, I'm going to take another look back inside of your oral cavity. So I'll get our tongue depressor and also our pen light. And I need you to open for me and say, ah, ah, ah. Ah, ah, ah. Great. For the next part, this may be a little bit uncomfortable, but I promise to be very careful. I'm going to test your gag reflex. And to do this, I'm going to slowly and carefully walk the tongue depressor back along your tongue until it elicits a reaction, okay?
Okay.
Great, we found it. Excellent job, thank you. I know that is a bit uncomfortable. For the next part, we're going to do your oral sensitivity. So I'm going to feel the sides of your tongue and also your cheeks. And whichever side I touch, I want you to raise the hand on that side. So for example, if I touch the left side of your tongue, I want you to raise your left hand. Okay?
Okay.
Great. We'll do your tongue first. Excellent. Now your cheeks. That was great. Excellent job. And now I want you to say an ah. Great. So now I want to see if you can sustain, for how long you can sustain that, okay?
Okay.
So I want you to take a deep breath in and sustain an ah for as long as you can. Excellent. That was great. Wow. Very impressive. Now I need you to try and raise your pitch like this. Ah, ah.
Ah, ah.
Excellent. And give me a good strong cough like this. And clear your throat like this. Great. And now for the last part of this oral mech exam, I'm going to have you do a dry swallow. And this is where you swallow without any food or liquid administered. It's just maybe the saliva within your mouth. So if you can collect a little bit to swallow for me, if you can collect that. And I'm going to gently feel the muscles of your neck. And feel free to swallow when you're ready. Excellent. That was perfect. Well, that concludes our oral mech exam, the first part of the bedside evaluation. So we'll come back here shortly and do your food and liquid trials for the second part. You did well. Thank you.
You're welcome.